So when you go to the hospital and you're going to get some fluid, so let's say you come in the hospital and you have headache or you have belly problem or you have back pain, whatever you do, almost always when they're going to give you some fluid, they never say, here, take this glass and pour some water from the sink or from the tap into that. That's not what happens ever, right? It never happens that way. And in fact, almost any condition that you go into the hospital for that you need some fluids, it's almost always, I can think of maybe a couple of conditions that's not sodium chloride. It's always sodium chloride, a 0.9% solution that they put in your vein. So when you're working out and you're losing salt and losing water and losing all these electrolytes from your system, it's not the best thing to grab your liter or gallon bottle of water and just kind of throw it back and just drink that water and call it a day. That's not how this works, right? And a lot of you may feel sometimes even lightheaded or dizzy when you're working out because you're losing all these electrolytes, and then what you're replacing it with is just water. Don't do that, right? If you remember, take 2 or 3 granules of Himalayan salt, organic, or Celtic salt, and drop that in your water, right? If you're going to drink some water when you're working out, and see how that works for you. And you're not just replacing just sodium, but a lot of the electrolytes that you're missing from just drinking plain water, you can help not completely normalize it now. You'll help that a little bit by using one of those salts as opposed to just drinking water. I'm not a fan of table salt per se, but Himalayan salt or Celtic salt should work. A couple of granules in your water when you're working out. Or really, if you're drinking large volumes of water, I would consider that. Anyway, thanks for listening.